So what is medical ozone?
So we use medical ozone gas to treat various diseases.
Right, for anything related to pain, that's what you're using it for.
We use it for slip disc, knee pain, back pain, neck pain, frozen shoulder. So these are some of the common things. I use ozone therapy to treat such conditions.
How does it work on the biological level?
So once the ozone gets inside the body or in the blood, it stimulates the mitochondria, which is present in the cell. So it boosts energy.
I've seen or probably heard about people using it for beauty treatments also.
Thing is that you are increasing the oxygen supply
Inside your body.
So eventually your skin will glow.
Slip disc is a very common occurrence which has been happening, Does it heal with these kind of treatments?
When I'm doing ozone therapy, we inject the ozone into that disc which is slipped off. So when the ozone goes in the disc, it dissolves the disc.
Look at the future of orthopedics towards more preservative medicine.
So it's like knee preservation in the era of knee replacement surgery.
Today on Who's Solar, we have with us Dr. Gautam Shah, an experienced orthopedic surgeon. What makes Dr. Shah work special is his focus on non-surgical treatments. So today we're going to talk about ozone therapy, pain relief, and how modern medicine is moving towards healing with less invasions and more care. Dr. Gautam Shah. Namaskaram. Dr. Gautam, very well-known doctor in the orthopedic space. And Doctor, thank you so much for being with me. और बहुत बढ़िया आपने वक्त निकाल कर यहाँ पर आ गए.
Thank you very much for having me here. Thank you very much.
So आपका जो speciality है ozone. The common thinking is ozone is XYZ, but ozone आप as a medicinal way you have used it, it is commonly perceived as harmful. So what is medical ozone और क्या करते हैं आप डॉक्टर?
So it's a good question. So in ozone therapy, basically ozone therapy, it's a gas. So we use medical ozone gas to treat various diseases. So ozone, if you see that there is an ozone layer on top of the earth.
That's what we heard.
Okay, so it protects us from the harmful effects of the ultraviolet rays of the sun. Now we use medical grade ozone.
Okay.
So how do we prepare ozone? So it's freshly prepared. We use medical grade oxygen connected to the ozone generator. So oxygen goes inside the generator and comes out as O3, ozone.
Okay.
So we collect freshly prepared ozone and then we use it to inject it in the various part of the body.
And applications कहाँ पे होती है? Various part आप जो बता रहे हैं, right, for anything related to pain, that's what you use it for.
So being an orthopedic surgeon, I practice in Mumbai. I use ozone therapy in various orthopedic ailments, especially for patients having knee pain, knee osteoarthritis, knee pain because of age, is because of wear and tear. So it's called osteoarthritis, or it's also called arthritis of the knee.
Okay.
Then we use it for slip disc.
Okay.
Patients who are suffering from back pain or sciatica. So we use it there. We inject it into the disc space. Then we also use it for patients suffering from frozen shoulder. So common conditions what we see in our OPD practice is knee pain, back pain, neck pain, frozen shoulder, then this tennis elbow, then even the heel pain.
Okay.
Okay, so these are some of the common things what we see in our practice, and I use ozone therapy to treat such conditions.
How does it work on the biological level? Once it goes inside your body, what is the process which happens inside the body?
Yes. So ozone is given in two ways. One is the external and one is the internal.
Okay.
To broadly, if you want to classify it. So externally we use it for patients suffering with diabetic foot ulcers.
What is that?
Okay, so patients who are diabetic patients who have got long-standing diabetes, these patients are prone to get ulcers on their feet.
Okay.
So these ulcers, because of high sugar levels and long-standing diabetes, these ulcers do not heal.
Okay.
Okay, so they are called as the non-healing ulcers.
Which I heard where they have to cut the toe and all that. That's the
Yes,
condition
so-
which comes to.
Yes, so earlier बहुत समय पहले हम इसको amputations करते थे,
Right.
because these wounds could not heal.
अच्छा.
So ये wound क्यों नहीं heal होता है? Because there is lack of blood supply and lack of oxygen.
Okay.
So when you give ozone to such patients who have these kind of wounds, when the ozone is given, we are giving extra molecule of oxygen.
Okay.
So increase of oxygen supply to the wound and the tissue around, so that it helps to heal the wound. So the rates of amputations have gone down drastically.
To just micro understand this, the ozone goes into your body, it kind of heals or gets the inflammation down. That's how it works.
Yes. So once the ozone gets inside the body or in the blood, it stimulates the mitochondria which is present in the cell.
Okay.
So it boosts energy.
Okay.
It also helps to regulate the immunity.
Okay.
So it's also called as an immunomodulator. Then it has got strong anti-inflammatory action. So we use it in a lot of orthopedic conditions to decrease the inflammation and pain. Most important is it is antiviral, antibacterial and antifungal. So in short, it's called antimicrobial effect.
So it, and how long does this last?
So it basically kills the bacteria, the viruses and the fungus. You have to give these ozone sessions. Say for example, patients with a diabetic foot ulcer or a non-healing ulcer, then we have to give ozone frequently. Say maybe twice a week or thrice a week. We have to give this to ensure that the wound heals well. So in case of diabetic foot ulcers, we give something what is called as a ozone bagging.
Ozone?
Bagging. So
Bagging.
Bagging, ozone bagging.
Okay.
So the patient has to put the limb into a ozone resistant bag.
Okay. What does ozone resistant mean? No, just for me to understand.
No.
like-
So basically you can't use plastic.
Okay.
Okay, because it acts on the plastic and gives the harmful products.
Okay. So ozone this is the external thing which
The
you're
external thing I'm talking about.
talking- Yeah.
So it's like a bag, you wear a bag
Okay.
and then you insert ozone inside the bag. So it's like a balloon.
Okay.
Okay, you put your limb inside the bag and then you close it, then you put the ozone in it so that the ozone acts locally over
Okay.
the wound.
Okay. So this is like a plaster, if I have to say in
It's
common.
not a plaster, it's like a bag.
We'll look up and put this image also on
Yeah.
that. Right.
It's like a bag. Then internally we give ozone with something what is called as major auto hemotherapy.
Okay.
Means we take out patients about 250 cc of blood
Okay.
in a glass bottle, and then we mix 250 cc of ozone
Okay.
into that glass bottle, mix the blood with ozone, and that mixture is again given back to the patient.
Okay.
Okay, so it's called auto means your own, hemotherapy means blood.
Right.
So we use your blood, we take out, as I said, we take out 200-250 cc of blood, mix it with ozone and give it back to the patient. So this helps to increase the blood supply, it helps to increase the oxygenation to the tissue. As I said, it is an immunomodulator, it modulates your immunity, plus it has a strong anti-inflammatory role, so it decreases the inflammation also.
Okay. So this part which you're saying about mixing with the blood, the ozone, but I've seen or probably heard about people using it for beauty treatments also. Does it work like
so
that?
it basically the underlying thing is that you are increasing the oxygen supply
inside your body.
So eventually your skin will glow, then you have a good energy boost, you feel energetic, and as I said, it's strong in anti-inflammatory, so inflammation decreases. So overall feeling of well-being. So it's a strong rejuvenator. So we use it for rejuvenation also.
So in which of your medical conditions which are till now kind of treated, which is the most consistent thing which has happened till date? मुझे सबसे ज़्यादा इलाज फटाक से किस चीज़ में हो जाता है?
So as I said, बहुत सारे पेशेंट घुटनों के दर्द से आते हैं ओपीडी में, कमर दर्द से आते हैं, फ्रोजन शोल्डर से आते हैं, खंदा जाम हो जाता है, हिलता नहीं है. तो घुटनों के दर्द के पेशेंट तो हर घर में आपको आपके माताजी, पिताजी, चाचा, चाची, कोई ना कोई बुजुर्ग पेशेंट होता ही है. तो काफ़ी सारे लोगों को घुटनों में दर्द होता है. इट्स अ वेरी कॉमन थिंग. एवरी ऑर्थोपेडिक सर्जन सीज दीज पेशेंट्स हैविंग नी पेन. सो इन पेशेंट्स को काफ़ी डॉक्टर्स ने इनको सलाह दी होती है कि आपको नी सर्जरी, ऑपरेशन या नी रिप्लेसमेंट सर्जरी की ज़रूरत है. तो नी रिप्लेसमेंट सर्जरी इज़ अ वेरी गुड थिंग, बट दैट we do it at late stage of arthritis,
which you are also an expert in. You're an orthopedic surgeon.
Yes, that's what I'm saying. So but in an early stage, if the patient comes in early stage, say mild to moderate arthritis of the knee, if they come in a mild to moderate stage, then non-surgical options are good. You can always try non-surgical options. So ozone therapy is a non-surgical option. It is also minimally invasive. Now minimally invasive का meaning कि that procedure is done by using a small needle. We take the needle and inject the ozone into the knee joint. Okay. इसमें हॉस्पिटल में भर्ती होना ज़रूरी नहीं है.
Okay.
No need for admission in the hospital. These are all OPD based procedure, can be done in your own clinic. Okay, we take care of the aseptic precautions. We ensure that everything is sterile, and then we inject the ozone into the knee joint. अभी ozone knee में देने से क्या होता है? तो once you inject ozone in the knee, it increases the oxygenation in the knee joint. It also helps to repair the tissue.
Okay.
It also helps. So it oxygenates the joint. It also helps to repair the tissue. Plus it is a strong anti-inflammatory. So the inflammation decreases and the pain decreases. जब पेन कम होता है तो मोबिलिटी बढ़ जाती है, पेशेंट आसानी से चल सकता है.
अभी इसमें स्टेजेस है, आपने जैसे बताया फर्स्ट स्टेज, सेकंड स्टेज, थर्ड स्टेज, फोर्थ स्टेज. आप इसके पहले एक जनरली डू अ चेक और probably x-rays and all are done,
do
right?
x-rays, MRI and clinical examination, which is most important.
Okay.
To see how the knee joint is. So based on the clinical radiological correlation, we know that the patient is in a first stage or a second stage or mild stage or moderate stage. Then depending on I plan how this patient would be treated. So if the patient comes in at a later stage, like if the patient has got severe knee osteoarthritis, then they are very good candidate for a total knee replacement.
Okay.
Yes. But nowadays I have seen in my practice that many patients who are even in stage 3 plus, they do not want a knee replacement surgery. They don't want surgery. There are a few reasons why patients don't want a knee replacement surgery. So like it's number one is a lot of patients are scared of surgery.
Right.
डर लगता है क्योंकि उम्र बढ़ जाती है. A lot of they come at 70 plus and they are scared of surgery. Second is they have a lot of other comorbidities. मतलब बाकी मेडिकल इश्यूज बहुत होते हैं. किसी को हाई ब्लड शुगर होता है, हार्ट प्रॉब्लम्स होती है, हैव अंडरगॉन various heart surgeries, kidney issues are there. So these patients who are medically unfit for surgery. So पहला हुआ एक patient is very scared for surgery. दूसरा he is unfit because of medical conditions. Third is not many people can afford this surgery also.
True.
So patients who basically come from rural area or from low socio-economic strata, for such patients then ozone therapy would be a good option to treat with.
आपने बताया कि people who have heart problems and high blood pressure, is it safe to have this ozone therapy?
Yeah, it is safe. It is safe to have the ozone therapy because here we are giving it locally into the knee joint.
Okay.
So it remains in the knee. It doesn't
so it
spread
stays
inside.
there.
It stays there.
Okay.
So as I said, these are few indications where patients do not wish to undergo surgery. In such case, when I do these procedures, by giving them the ozone injections in the knee joint, I am helping them to be pain-free, decrease the inflammation, patient is able to walk, patient is able to do the exercises. So the main aim of the treatment is that the patient should be pain-free and should enjoy good quality of life.
Right. So you spoke about osteoarthritis.
Yes, that is wear and tear of the knee.
So after giving this ozone treatment, it helps them in the improved joint function which happens.
Yes.
And the degeneration also goes slower?
Yes.
It does.
It also helps to decrease the speed of degeneration. Okay. So basically by doing this, I am either preventing a knee replacement surgery or avoiding a knee replacement surgery or delaying the knee replacement surgery.
You mean to say people, if you detected them from the first stage, the chances of knee replacement will go down drastically, is what you would say?
Yes. So by doing this injection in an early stage, follow it with good physiotherapy,
okay,
good knee exercises, good bone health, and if the patient is obese, then we definitely ask them to lose weight.
Okay.
So it's a combined thing, it's the patient also has to take care of his own knee. So after the injection, he has to do these things.
Okay. So, doctor, I had one more well-known doctor called Dr. Vijay Shetty. You know him.
Yes.
Also. So he's an orthopedic surgeon. He also doesn't like to go into the surgery part. He also does PRP and all these kind of things which you all are into, which is alternative medicine, I would say. Is that so?
Ozone therapy is an alternative
medicine.
Yes.
So he also said one thing, ki most of us Indians, because of the habit of sitting cross-legged, is a reason for knee-related issues. Is that so? And how much of this knee or the joint problems is prevalent in India compared to internationally?
So, joint issues are there all over the world.
Okay.
It's not that only we Indians are affected by it, but mainly because of few things what we are habituated, like squatting.
Okay.
When you squat, the knee takes up a lot of pressure. And then even sitting cross-legged.
It does.
Right. So, and of course obesity, as I said. So, these things are there which increases the wear and tear of the joint.
Doctor, do you combine PRP with ozone treatment?
As I said, we use ozone as an adjuvant treatment, but a combination of platelet-rich plasma, which helps to heal the tissues, and a combination of hyaluronic acid, that is also called as the gel shots or the gel injections or the oil injections.
What is the content in that?
It's called the hyaluronic acid.
Okay.
So if you inject hyaluronic acid in the knee joint, it basically lubricates the joint.
Okay.
And PRP helps to heal the tissues.
Okay.
And if you inject ozone in it, so it also acts as an anti-inflammatory agent. So it helps to decrease the inflammation. So you get the oiling, plus you get the healing, and you get decrease of pain and inflammation. So it's a combination of these injections helps the patient to relieve pain.
So this is done in one sitting?
Yes, this is done in one sitting. Sometimes you require a few additional sittings also to treat such patients.
We staying in the urban side of India, you have started your career mostly from the rural side.
Yes.
You still go there, you do a lot of things around the country, from Himachal to Dhule, from where you belong.
Right.
Is there a difference with our lifestyle here compared to what happens in rural India?
Yeah, so to answer this question, yes, the lifestyles are very different in the metros, in the rural areas, and of course in the hilly areas. So in the metros, in cities like Bombay, Pune, Calcutta, so we have a lot of sedentary lifestyle.
Right.
Right. Plus, the food habits are so different. So if you add this, and also there is lack of sunlight.
Okay, because we are mostly indoors.
Yeah,
And
so like, you get up in the morning, you sit in the AC car, you go to the office, you're in the AC. By the time you come back home, it's late in the evening, it's already sundown. So you go very low on vitamin D levels. So that's really very important for a good bone health.
right.
So if you see that, these are the problems what we face in the metros. So eventually, because of sedentary lifestyle, you tend to put on weight.
Okay.
Again, that affects the joints. So in the rural areas, of course they are exposed to sunlight, but the work done is heavy work. They're working in the farm. They're continuously squatting, continuously sitting, and continuously working, hard labor. So again, there is wear and tear of the joints.
Okay.
If you compare that to the hilly regions, where I also go to work in Manali, that is in the Himachal Pradesh. So there in the hilly regions, because of the hills, again, the knee takes a lot of brunt, because they keep carrying a lot of heavy weights on their back, and they have to climb the hills, and the surfaces are also quite uneven. And because of this kind of a lifestyle, again the knee takes a brunt of the weight. So again there is a wear and tear happening in the knee joint. So more the wear and tear, more the pain in the knee joint.
Okay.
So we spoke about the knee.
Knee.
Now we have the back and the shoulder, frozen shoulder, or whatever.
We'll go to the back because
yeah.
that's the most common problem most of the
Yes,
people have.
yes.
Slip disc is a very common occurrence which has been happening, I mean, I know friends who had slip discs when they were in their 20s also. So does it heal with these kind of treatments?
So basically, patients who come with back pain or slip disc or sciatica, once it is diagnosed that the patient has got the common slip disc in the lumbar region, in the back region, is the L4-5. That's what a very common thing what we hear. That L4-5 disc has prolapsed, or there's a slip disc at L4-5 level.
Okay.
So there are various treatment options available for this problem, this issue of sciatica or slip disc. Right from analgesic painkillers to physiotherapy to minimally invasive procedures to surgery. So there are various treatment options available. What I practice here is I do minimally invasive procedures, and I'm using ozone therapy to treat patients with sciatica or slip disc.
Okay.
So how do I do that? So when the patient comes with back pain, and once he's diagnosed with an L4-5 disc, this procedure is done in an operation theatre, and it is done under local anesthesia. It's a day care procedure.
Okay.
Taking the patient in the operation theatre under an X-ray control, X-ray guidance, we locate the L4-5 disc.
Okay.
So after we locate the disc, we take a needle and we puncture the disc.
Okay.
And when you enter into the disc, we inject the ozone gas. Say about 5 to 10 ml of ozone gas is injected into the disc.
Okay.
What happens? When the ozone gas enters into the disc, the disc material dissolves gradually.
You mean the bone part of it?
No, disc does not, it's not a bone.
Okay.
In between the two vertebrae is your disc.
Okay.
Our disc, they act as cushions.
Okay. It's like a jelly kind of
Yeah,
substance?
it's like a jelly kind of a substance.
Okay.
It's like a cushion.
Okay.
It's a shock absorber.
Okay.
So that slips off from its natural place.
Okay.
It slips off and it compresses on the
Bone.
nerve root.
Okay.
Nerve root.
Okay.
It compresses on the nerve root.
Okay.
Okay, say for example, the L4, L5 nerve root is getting compressed or pinched. So the patient will have back pain radiating down into the leg.
Okay.
And that's how the patient comes to the OPD saying, डॉक्टर मुझे कमर में बहुत दर्द हो रहा है, वो दर्द
पैर तक है।
पैर में नीचे जा रहा है, पैरों में दर्द हो रहा है, झुनझुनी आ रही है. These are his complaints.
Okay.
So this is a very simple procedure and it is done under local anesthesia.
Okay.
Does not require general anesthesia. There is no surgery, कोई टाका नहीं, कुछ नहीं.
Okay.
So under local anesthesia, this needle is inserted, inject the ozone gas and then you come out. And that's it.
And that works like the cushion. The ozone.
So the cushion which is already there
Okay.
has slipped off
Okay.
and it is pinching the nerve root. Surgery में क्या होता है? The basic difference in the back surgery and ozone is one, this is not a surgery. Second, in surgery जो डिस्क सरक गई है उसको पकड़ के निकाल देते हैं.
अच्छा, निकाल ही देते उससे?
बिकॉज इट इज़ ऑफ नो यूज़.
अच्छा.
वो सिकुड़ गई है.
अच्छा.
इट हैज श्रिंक्ड
हाँ.
एंड इट हैज कम ऑफ
हाँ हाँ.
फ्रॉम इट्स प्लेस.
Okay.
So it is of no use.
Okay.
So then eventually with surgery you remove it. When I'm doing ozone therapy, we inject the ozone into that disc which is slipped off.
Okay.
So when the ozone goes in the disc, it dissolves the disc.
Okay.
So when it dissolves the disc, it gets off the nerve root pressure.
Okay.
तो nerve root के ऊपर का जो pressure है वो हट जाता है. And the patient becomes pain free.
And this lasts for how long?
And then it's permanent.
It's permanent.
Yeah, but sometimes we may have to repeat the procedure.
Okay.
But many a times patients get away with one procedure itself.
So this you're seeing through X-ray and doing
Yeah,
all this under
we have an
process.
X-ray control.
Okay.
It's called a C-arm or an image guided procedures.
So it's constantly watching and doing this.
Yes. We watch it. And we exactly target the site, and that's the place where we inject the ozone gas. So as I said, this is a daycare procedure for the spine. Once it is done, the patient goes home, and then we put him on a good back strengthening physiotherapy exercises for his back. So it's a daycare procedure, minimally invasive, cost effective. Patients can avoid surgery and he can get back to his work as early as possible.
Whenever we say slip disc, we think that guy is going to have it for life. The way you put it in such a simple format, I mean, it clicks for me. मतलब बहुत बढ़िया है करके. So which is
Well, it is true.
Yeah.
Using this as a modality of treatment. So I'm using ozone as one of the armamentariums in my practice, and which I'm getting good results with this.
So
It's a natural way of healing.
Yes.
It's a natural way of treating because ozone gas, it's a natural gas. So I'm using medically the medical grade ozone to treat all various ailments in orthopedics.
see this ozone, I'll just jump the question. The ozone, medically graded ozone, is created in your place. I mean,
Yes.
you do create it on your
Yes.
own. That's how it works. I mean, there's a procedure to
Correct.
create.
So as I said, there's an ozone generator, and then you attach the oxygen cylinder, the medical grade oxygen cylinder. Oxygen is attached to the ozone generator. So the oxygen goes in and comes out as ozone. And you freshly collect the ozone.
Slip disc, you said L4, L5
It's very common.
is the common one. Then it can be the other layers of the
Yeah,
spine.
so other is the cervical region. That's in the neck.
Okay.
Because these two segments of the spine are mobile.
Okay, so when we twist and
Right. So there are more chances that the disc slips off.
okay.
The back or the thoracic portion is more stable. It's less mobile.
Okay.
So you don't get much of slip disc happening in the back region, in the thoracic region. जिसको हम पीठ कहते हैं,
पीठ, हाँ जी. तो अभी
गर्दन में मिलेगा और कमर में मिलेगा.
अच्छा.
Slip disc is very common in this area, that's called the gardan or the cervical spine, and the lumbar spine, or that's the kamar.
So for me to understand as a common man, ये जो अपना स्पाइन है, जो पीठ है, तो L4, L5 ये पूरे रीजन में है क्या?
नीचे कमर का जो
बेस,
हिस्सा,
जो लोअर बैक जो है वहाँ पर होता है ये.
That's right.
But बाकी when it comes to the rest of the spine, there are multiple
multiple vertebrae.
So but L4, L5 is
very common.
It's common. But the other regions also, does it work?
It works, but it is not. We don't get to see slip disc in that area,
unless it's a serious injury or something, probably. Which can happen. So but it's, as I said, irrespective of all these other vertebrae, this is okay to use this therapy.
Yes, very much.
So safety is a major concern. What are the known risks or limitations when it comes to ozone therapy?
Okay, so basically ozone therapy is contraindicated in patients with blood disorders. मतलब जिसको हीमोफीलिया है, ब्लड डिसऑर्डर्स है.
हीमोफीलिया इज ब्लड डिसऑर्डर,
जिसमें ब्लीडिंग होता है.
अच्छा.
सो ब्लीडिंग डिसऑर्डर्स.
अच्छा.
सो दीज आर द डिजीजेस वी डोंट डू ओजोन थेरेपी. इट्स कॉन्ट्राइंडिकेटेड.
ओके.
Okay. So otherwise it is very safe to use it.
Yeah. So before you start the therapy, you go through all these parameters of checking the patient.
We do certain investigations, and so like the test like G6PD. We also rule out patients for thyroid and blood disorders.
So thyroid patients also, it's not recommended, is what
no,
you
it's
say.
not. No, it's not so. It is not so. But it is not done in cases where the thyroid activity is more. It's called hyperthyroidism. Okay, but we don't get to see much of hyperthyroidism. But a lot of patients have hypothyroidism, that is low thyroid activity.
Okay.
In that case, it is very safe to use. Blood disorders, it is an absolutely contraindicated.
So ozone therapy has been used globally, right?
It's been used for a very long time, since many years. And slowly now a lot of countries like all of Europe, Russia, and now even we Indians are also doing it very regularly.
Okay. So in India, has it come off recently or?
Yes. So in India, we have an organization called as the Ozone Forum of India.
Okay.
Yeah. So there are a lot of doctors who are members of this Ozone Forum of India, and we are amongst the few doctors who teach ozone therapy to various doctors in India and abroad.
When I'm understanding this, is ozone present in the body by any way?
No, it's not present in our body.
Externally only, like.
Yes,
so because the body has some form of oxygen which is constantly there, but ozone is something which is externally which you use.
Yes.
Why people are still skeptic about something, What I just did a bit of reading, and people are still finding it this because it takes some time for a particular procedure to come into that.
As I said, it's an alternative therapy. Okay, so a lot of doctors are aware of it. Some of the doctors may or may not agree with this also.
Achha.
Especially the allopathic doctors, as it is not taught to us in our medical college. So being an alternative treatment, it takes time, takes a while for it to get penetrated into the medical field.
Okay. But it's been used by probably top doctors also around the world.
It's been used widely all over India and all over the world. Many doctors use it, as I said, to treat various conditions.
There's something called hyperbaric oxygen therapy.
So
it's been helping and probably non-healing ulcers and preventing amputations also, right?
Yeah. So hyperbaric oxygen therapy, basically it's a chamber where the patient sleeps in the chamber, and he breathes oxygen at a high pressure. So like for example, you and I are breathing oxygen at 1 atmospheric pressure. This is at sea level, 1 atmospheric pressure. So anything above 1 atmospheric pressure, so 1.5 or 2 atmospheric pressure, if you breathe, it's called hyperbaric.
Okay.
So hyperbaric oxygen therapy is breathing medical grade oxygen at 1.5 or 2 atmospheric pressure.
Okay. The reference to this goes to Michael Jackson. He used to, he used to sleep in this because it's good for his skin and all
that.
that.
So basically, again, when you're taking a session of HBOT or hyperbaric oxygen therapy.
HBOT?
Yes, hyperbaric oxygen therapy. Okay. HBOT, that's the short form.
Okay. So the hyperbaric is what? There's one more content of oxygen in it. What is it like?
So hyperbaric oxygen therapy is giving you're breathing medical grade oxygen, pure oxygen.
Pure oxygen. Okay.
You're breathing at a high pressure.
Okay.
So when you're breathing at a high pressure, more the pressure, more the oxygen is dissolved in the body.
In the body. Okay.
It's the Boyle's law what we use. More the pressure, more the oxygen is dissolved. So the areas where the tissues are devoid of oxygen, those places the oxygen which is under pressure is able to go to those areas where the oxygen could not reach. Say for example, as I told you, diabetic foot ulcers. So when the oxygen reaches the ulcer and the ulcer starts healing.
So in a chamber you are lying down and the oxygen is given in high pressure.
Yes.
So this kind of heals throughout the body.
So you're inhaling, you're inhaling that pressurized oxygen and the session lasts for about 90 minutes.
Okay.
Each session lasts for about 90 minutes and it is recommended that at least you take about 10 sessions or 15 sessions to see the difference in the wound. Okay. You have to take these sessions every day, daily one session, which is required.
Okay, so in a period of 9 days you complete the session, is that so?
No, so as I said, depends on the conditions and the wound and for what disease you are treating. So sometimes you may require to take more sessions.
Okay. And it helps throughout the body. It can help the rest of the. So you might have a diabetic foot, but still it will be helping
to oxygenate the tissue. So it's a very good anti-aging wellness treatment.
That's what Michael Jackson used to use.
So we use it because we are giving you oxygen. So moment you take oxygen, your body starts healing. You feel very energetic. You feel rejuvenated. So a lot of celebrities now are taking hyperbaric treatment.
So when you're talking about celebrities, one more thing comes to mind. You said about putting the ozone into the blood and do this. That's also the treatment they use.
That is also.
That's also the use for probably the skin. Yes. How does it help the skin?
So as I said, basically it pumps in more oxygen.
Okay. So it can change the layering of the skin?
No, it doesn't change the layering of the skin. It just have a skin glow. It's a good skin.
And how long does it last?
So as I said, you need to take frequent sessions of this.
Okay. And is it painful?
No, not at all painful.
Okay.
Oxygen chambers, you just have to go inside, lie down and just be in for about 90 minutes. You can even lie down, go to sleep, even meditate.
Achha. And it's like a lying down thing. Okay, my question was about the injecting of the blood back into your system. Is that painful?
No, it's not painful. It's like how you draw blood to do blood test.
Similar way.
Similar way, it's like that.
Okay. And this oxygen chamber which is there, it is something which you already have in your clinic?
Yeah. So these chambers are there in the hospital.
Okay.
So even few clinics also have these chambers.
Okay.
So where patients come and get this treatment.
So in your clinical experience, your years of practicing from a surgeon to getting into this therapy, what is something which has surprised you the most? मतलब ये कैसे हो गया करके ये treatment शायद it might have been a very tough situation with one of your patients, but ऐसा कुछ ऐसा था कि
yes. So this is a very nice question, and I've seen miraculous results in patients with slip disc and back pain.
Okay.
Where few surgeons have told that the patient would definitely require surgery. and the patient came to me and I treated the patient without surgery and with the help of ozone therapy, and to my surprise the patient did so well. So I have a very long follow-up of almost 18 years. The patient whom I had treated with ozone therapy, till date he is doing all his activities, and he did not require surgery.
Is there an age factor for this?
Yeah, I mean generally we can give it, we can treat patients of all age, right from children to adult to even elderly patients.
So even children also would need.
As I said, but the way to give it is different.
Okay. Is that the content which is used, or the quantity of that is
Quantity of ozone
is lesser with
yes,
kids?
and the concentration also.
How do you see this, doctor? Like years from now, will it replace some conventional methods?
So well, this is also called as the oxygen healing therapies.
Okay.
So hyperbaric oxygen, ozone therapy, it is the future of medicine.
This will work out.
Yes, this will work.
And how do we kind of put it across? Of course, through our podcast, we'll reach out to a few more people. But I think there has to be a little more awareness about this thing, right? And
so as I said, we conduct training courses for doctors, the basic course and the advanced course. It is conducted at Bisleri.
this Bisleri in
Andheri. Under the name of Ozone Forum of India, which I already told you. So we all are members of Ozone Forum of India, and we regularly conduct conferences and teaching programs to train the doctors.
Okay. So you look at this as something as just complementary, or something which can, I'm using a strong word, which can replace certain things in the future?
Yes. So you can use it as a complementary treatment. You can also use it as an alternative treatment to the treatment what you're already giving to the patient. You can even use it as a standalone treatment.
Let me come to what you do in helping people. Where did it start? I mean, you go to Dhule, you go to Himachal, you treat people, you spend your own money to do that. How did this giving back to society happen?
Yes, it was always there in me. My parents were doctors, so they used to do a lot of medical camps and charitable work. So I think that's how I've learned it from my parents. And of course, it feels good to see a smile on the patient when the patient is benefited by your treatment. And as I said, this treatment is cheap, and it can be, many people can afford this treatment. So, but the charity, as I said, is there within me. So I like to do this charitable work. I do it in many places, and as I said, I do a lot in Himachal, and I intend to even do more in Himachal and in Leh Ladakh regions. The reason behind is the medical facilities in such hilly areas is less. So if the patients can't reach you, I think you should reach the patient.
Very nice. From all the places you chose Himachal, because you love that place.
Very close to my heart. So me and my wife, we love to go there, and Manali has always been very near and dear to us. Almost 30 years ago, when we went for the first time, me and my wife, and we both had decided that we definitely would want to do something here.
Very nice. That's so nice of you to do this. And how often do you do it through the year?
Yes, I go once in 6 months. I conduct these free camp, or it's a pain management camp, which is done in a mission hospital in Manali. It's a very nice hospital, and they welcome me, and I treat almost about more than 200 patients at each camp.
Wonderful, wonderful.
Thank you so much.
You focus purely on knee preservation rather than knee replacement.
Yes.
So this is a wonderful thing, and I like holistic medicine on a personal level. So which is why I would probably look at the future of orthopedics to happen the way you are wanting, towards more preservative medicine.
So it's like knee preservation in the era of knee replacement surgery.
Yes.
Okay.
Yes.
So yes, knee preservation is possible, but it is also difficult. But my field of interest, as I said, lies in knee preservation. So I like to treat my patients non-surgically by using these various things like the ozone therapy, the regenerative medicines like platelet-rich plasma, growth factors, and also hyaluronic acid. So a combination of these treatments, they work good for the patient.
So, have you tried all these methods in one way, like where you're using multiple ways to get the patient to come back to normal, right?
Yes.
So, does it apply for everybody who comes in, or you see the patient and this is what is going to work?
It's a very personal and a very individualized approach.
Okay.
It's not one size fit all. Okay. So each patient is different. Each knee is different, and each patient comes with a different stage of arthritis. So you have to select the patients properly so that you are able to give good results without surgery.
See, I see a lot of Indian ladies specifically who the toes are twisted. So that's a form of arthritis, right?
Yes.
The toes get almost turned around.
Yes. So there are different forms of arthritis like rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, osteoarthritis. So there are different forms of arthritis, and the different form of arthritis present in a different way. So the one which you are talking about, that the toes and the hands, they are all deformed, that is because of the rheumatoid arthritis.
Does this help?
To a certain extent.
And do we see a future of helping such cases, because their entire walk also get deformed when they get this kind of condition?
Yeah, as I said, if they come in a late stage with a lot of deformities, then surgery is the best option.
So you're doing a lot of charity over the years. How have you evolved as a human being, helping people, and what do you look forward to?
Well, it's a very humbling experience. When you see somebody is in pain, cannot afford treatment, and if you're able to make this patient pain-free, I think you are helping the patient, and वो कहते हैं ना कि उनकी दुआ मिलती है. So that's the most important thing for me. So it's the patient becomes all right, he's happy because of your dawa and dua.
क्या बात है. This is something which will stay forever, because I believe in the practice of gratitude and blessings, because this is what gets all of us going. No matter how much you're doing to society, giving back is so important, and I'm humbled to have you on the show. I don't know what more I can ask you. You almost given most of the answers to what I had in mind. Is there anything else, doctor, which you feel?
The last thing I would like to say is, and I tell many of my patients that ये भी नहीं ठीक कि सारे दर्द मिटा दे.
अच्छा.
कुछ दर्द कलेजे से लगाने के लिए होते हैं.
क्या बात है. This is going to be the echo part of our show. Thank you so much, doctor.
Thank you
for coming.
Thank you.
It's been a pleasure. You took time out in a busy schedule and you came here.
Thank you so much.
It's such a pleasure. So here we like to ask you to like, share and subscribe on our show to watch more strong conversation like this, which is also about alternative medicine and what you can do good for your own self. Thank you so much.